this. See, the chronic inflammation damages tissues over time. It's just making you feel tired or sore, and it's contributing to these diseases like heart disease, diabetes, arthritis, and even cancer. Welcome back to the Freedom Health Show. I'm Dr. Matt, and today we are going to be diving into the topic of this thing that is silently impacting every single one of us, and that is inflammation. You see, when you hear the word inflammation, you might think of a sprained ankle or maybe even like a sore throat and your throat is inflamed, right? But did you know that there's another kind of inflammation, a silent, ongoing, that's causing damage that you may not even realize? Today, we're going to explore the differences between this chronic inflammation and the more familiar kind of inflammation that people are aware of when you sprain an ankle or you injure a knee, or you can actually see that inflammation from a bug bite, right? We're going to talk about how it affects your health and why it's connected to so many diseases, from heart disease and diabetes to autoimmune issues. So let me ask you, could chronic inflammation be affecting your health in ways that you don't even see or you don't know about? So let's get started, and we're going to start breaking down what inflammation really is. See, inflammation is actually a defense mechanism. So it's a normal process for the body. It's your body's way of fighting off infections or healing injuries. So for example, say you twist an ankle, right? It swells up, and that's acute inflammation. And that's a good thing. It means your body's going to do what it's supposed to do. It's going to jump into action, and it's going to start to heal and protect you. But there's a chronic inflammation, and this is different. You see, chronic inflammation is like a low-grade fever that never really goes away. It's a smoldering fire in the body that causes damage over time. And here's the catch. You often don't feel it happening because these are the things that happen every single day. It may be like you're getting itchy red skin, right? Well, there's an inflammatory reaction going on. It may be like your bowels aren't moving well enough. It may be you wake up in the morning and you're just kind of stiff in the hands, right? And then one day you realize, man, you've got this chronic inflammation and it's been building slowly over the years, and it's a result of lifestyle factors, stress, and even environmental toxins. So let me give you guys an example. Imagine you're cooking and you can't leave the stove on, okay? And there's just this low simmer, and you forget that it's even there, right? And eventually that simmer is going to burn the food. It's going to evaporate your whole pan of water, maybe you're boiling, right? But it doesn't happen all at once. It's a chronic inflammation, and this happens a lot of time, and it's a slow simmering process that can lead to damage in the tissues and organs over time. And when these organs and tissues become damaged, your body has to handle this, and it starts to attack it. Oftentimes, this is where people will get what's called an autoimmune disease, right? Where the body's starting to attack itself. But is it really attacking itself, or is it actually going through a normal, healthy process? So here's the question. If this inflammation is a silent process, how do you know if it's even happening? Well, let's talk about some of the chronic causes, or the causes of this chronic inflammation, okay? This is where it gets a little bit interesting, because these are things that you probably do every day, and you don't realize it's actually driving these inflammatory factors. And these are in your own lifestyle. Maybe even your family did this, okay? Your grandparents, your parents did the same thing, but it's increasing inflammation in your body. So these foods that we eat, the stress that we carry, and the air we breathe, it all adds up. Have you ever noticed that after a few weeks of eating out, you just feel sluggish or achy, okay? That's often a sign of inflammation. And you see, people don't realize that because we do this all of the time and we feel these things all the time. It's almost taken as normal. You know, years ago, I was watching this documentary, and this guy did an experiment of eating McDonald's every day for 30 days. And he tested his blood in the beginning and after it, and at the end of 30 days. But throughout this process, they documented this whole thing. And by the end, he couldn't even sleep because his body was so inflamed. He couldn't concentrate. He couldn't focus. His doctors said, like, you got to end this because your cholesterol, your blood sugar, your blood pressure is so high after 30 days. And so he was literally just putting gasoline on the fire for 30 days. And this is a guy who was in great shape. When he started, all of his numbers looked perfect. and this chronic processed foods and toxins he was putting in his body just added up very quickly. And research shows that diets high in processed foods, sugars, trans fats can just drive this inflammation. Okay. And so there's an article actually in Science Daily about how inflammation, it's the root cause of many diseases that we have today, and how diets actually play a huge, huge role in this. Now, I get it. A lot of us don't even know what's in our foods. And I've talked about it on other podcasts, and what RFK is going to be doing to get these chemicals out of the food and making our foods more natural. I mean, if you look at foods from other countries, there's 3, 4, 5 ingredients into it. When you look at the back of a box of food that we get from the grocery store here in the States, there's words you can't even say or understand. You have to have a dictionary to know what they are, right? And yet they're filled in all of our foods. These are chemicals. These are toxins that shouldn't be in there. And they're found in American diets all the time, and they're promoting inflammation. So here's the question. Do you think your diet is adding fuel to the fire in your body and creating more inflammation? Think about it. I bet it is. I know I screw up. I'm not perfect. I sit on here on this podcast, and I will tell you, I make the same mistakes as everybody else, okay? I try to do my best, and that's what we all can do, and just keep chipping away and improving what we're doing. But the reality is we all get caught up in it. And guess what? It's not just food. Stress is another major player. When it comes to stress, our bodies produce this hormone called cortisol, right? Which, when consistently elevated, can keep our immune systems on high alert. It's like running a marathon every day without any rest. And some of you guys do this and you don't even realize it. You wake up and it's that kids are up, busy morning, you grab a cup of coffee, you drive to work, you're there and you're cranking all day at work. You come home, you're handling kids again, and then it's that time to rest, and man, you got loads of laundry to get done, right? In fact, I was meeting with somebody just yesterday, and we're helping her lose weight, and her weight's going a little bit slow, so she actually decided to get one of those blood meters that she could put on her arm, and it would test her blood sugar all the time, continuously, right? And she had done it for about 4 or 5 days, and her blood sugar was steadily lower because we were working on making lifestyle changes, and she's looking great. Her body shape is changing, but the weight's not going down as much, okay? And so we looked at her blood sugar numbers, and at 9 a.m. every morning during the week, her blood sugar went up. So I said, what happens at 9 a.m. every morning? And she says, I show up at work. I said, okay, so stress is clearly affecting your body and causing this blood sugar to go up. So this is exactly what I mean. Many of us are running marathons, and we don't even know we're running the marathon because we get caught in this cycle of this is just the way life is, right? Eventually, it's going to wear down your body. It's going to wear down your system. And if we add things together like environmental toxins, pollution, and poor sleep, you can see how this is like perfect for inflammation in the body, and it just keeps on burning. So how often do we consider these day-to-day stressors as a real source of our problem? I actually had another patient who felt achy and tired all the time, and she thought it was just aging. You know how many people tell me that, oh, I'm just getting older? Hey, we are all getting older, but I will tell you, not everybody at the age of 50 has the same symptoms as you do. If it was an age thing, wouldn't we all be getting the same problems at, say, 40, 45, 50 years old? Now, there's one thing that I can guarantee you that is always an age thing, and that's our hair, and it's the wrinkles on our face. We all get wrinkles as we age, and we all get gray hair as we age. I haven't seen it any other way, right? Unless, of course, you're dyeing your hair. But then you're just putting another chemical and a toxin in your body, so you might want to reevaluate that or look for dyes that are not as toxic, right? But when we look at all of these things, they all start to add up. So by making some of these small changes to our routine and her routine and cutting back on the processed foods, adding relaxation techniques to her diet or to her lifestyle, again, we saw her energy come up and aches start to improve. And what's incredible, I find, is sometimes we can make very, very few adjustments, and it makes a huge impact. I mean, I've had with some people, they get 8, 9, 10 pounds off in a few days just by getting rid of the inflammatory foods. Now, that doesn't happen to everybody, but it can absolutely happen if we sustain that lifestyle over time. So why is chronic inflammation so dangerous? Well, it's really where inflammation starts, okay? And this is really where the problem comes. And we have to look at this. See, the chronic inflammation damages tissues over time. It's just making you feel tired or sore, and it's contributing to these diseases like heart disease, diabetes, arthritis, and even cancer. So, if we talk about heart disease, for instance, when it comes to inflammation and chronic issues, it can lead to hardening of the arteries. A lot of people say like, oh, cholesterol causes hardening of the arteries. Well, it really doesn't. It's the inflammation that oxidizes this cholesterol and the sugars in your body that creates the problem. You have the cholesterol, okay? Everybody has cholesterol, but it's the inflammation that's the bigger factor. And so when we start to think about reducing your risk factor for heart disease, inflammation is where we all need to start, because your body is going to create that inflammation to these insults that it gets, these stressors from the foods, from the chemicals, the toxins. When we think of somebody with diabetes, inflammation interferes with how your body responds to insulin, even setting the stage for even higher blood sugar. So doesn't it make you wonder how much we might unknowingly be doing to ourselves because we're treating our conditions with medications, and then we're filling our body up with toxins and chemicals? If we started to take a different approach, where would we be on this? One of the patients came in to me with type 2 diabetes maybe a year ago. He had no idea what chronic inflammation was. His doctors never really even said anything about it, and they just kept throwing medications at him. Okay. First it was metformin, then it was, I think, the added glimepiride, and then they started adding Jardiance, and then they were on Ozempic. I mean, they were on 5 or 6 different blood sugar medications. And, think about this. If you got to keep adding medications onto your diet, onto your lifestyle, I should say, do you think what you're doing that's stimulating this maybe should be looked at or talked about, okay? Like, if your doctor can't get it with one medication and he's got to throw 5 of them on there, maybe you need to take a different approach. Just saying, we have to start thinking differently. So we start to reduce his inflammation through diet and lifestyle, of course. Okay. Not only did this improve his energy, but naturally his blood sugar levels began to come down. Okay. And were much more stable. Now, what's interesting is that his doctor always said, just lose weight. And listen, if you've been told just to lose weight as a diabetic, you're totally missing the boat on this thing, because weight is a side effect of diabetes. It's a side effect of cleaning up your diet. It's a side effect of doing all the right things to get you moving in the right direction. So, isn't it amazing if we just think about reducing inflammation, how it can help all of these other things that we have going on in our body as well? So now that we've beaten inflammation to death, okay, let's dive into some different approaches that we can do to manage it. One powerful tool that we'd use with our patients beyond lifestyle changes is actually protomorphogens, okay? You see, when you have inflammation in your body, that inflammation breaks down the specific tissue that is inflamed. And that tissue then gets released into the body, and your body has to get rid of it, okay? And so that's where your body's attacking its own tissue, and it can turn into an autoimmune issue over time. So we use these specific supplements called protomorphogens, and what these are is they're specific tissue extracts that act as a decoy for the immune system. So basically what it does is it says that damaged tissue that is inflamed, and says, hey, come and attack this rather than the tissue, okay? So this way, your immune system doesn't continue to perpetuate the inflammation going on in that particular organ, and it allows it to heal. You see, the immune system may start actually seeing then a thyroid or digestive system, a pancreas, as foreign material, and can attack it over time, creating an autoimmune issue. So protomorphogens can be very cool to help take that stress off of tissue that is inflamed by acting as a decoy for the immune system. So by drawing that immune response to the protomorphogen rather than the actual tissue in your body, we can reduce that inflammation, and we can start to allow your body to heal properly on the inside, even with autoimmune patients. And we'll see a lot of autoimmune symptoms go down or reduce with protomorphogens. And what's cool about these is they're all organ specific. So I had a patient that had a joint pain. In fact, I think she had rheumatoid arthritis, okay? And we put her on osteotrophin PMG, which is a joint specific protomorphogen. And we saw a ton of improvements with it because her immune system was redirecting itself to the protomorphogen rather than the joint, allowing that joint to start to heal on the inside. And if you're ever looking for these protomorphogens, you can actually find them at their standard process protomorphogens, and you can find them at our website, LIfeWorksKC.com, where we have all these products available for you. And you can literally just go, hey, I've got Hashimoto's thyroiditis, right? Okay, you look at thyrotropin PMG. And so whichever organ you have the autoimmune challenge with, that's when you actually use. Another couple other ones that I commonly use with pain and inflammation is turmeric forte and boswellia. You see, what's cool with turmeric forte is that MediHerb has combined turmeric with fenugreek, which enhances the bioavailability of it into the bloodstream, which makes it a powerful antioxidant. Boswellia is also great for just general joint health and pain relief. By adding these two in, it can really make a huge difference with people's health, pain, and it can handle the inflammation even a little bit more. So, in closing today, I want to wrap up this episode because if you're thinking that you've got this chronic inflammation in your body, you need to start supporting it. You need to start making these small steps like incorporating anti-inflammatory foods, decreasing stress, even use these targeted supplements to help you get more. Okay. Yep. So as we wrap up this episode today, think about this. Are you ready to give your body the support needed in order to combat the inflammation? Like take the small steps to incorporating anti-inflammatory foods, adding some stress relief, trying some targeted supplements that can also make a huge difference. I want to challenge you today. Pick one thing over the next few weeks that you can start doing to reduce inflammation. Is it starting to have a salad every day? Is it cutting out a soda? Is it getting to bed a little bit earlier, taking some time just to be quiet and still with yourself? Okay? All of these things will help to decrease inflammation, balance your body. And remember, each of these small choices, they build a healthy path and a wellness direction for you to move in the right direction. So thank you for joining me today at the Freedom Health Show. Next time, we're going to dive more into gut health and other things to create foundational wellness. Until then, take care. And remember, health is a journey of small, consistent steps. So start taking them now because they're going to add up over time.